Hi, my name is Jacqueline Anne-Marie Cousins. I'm a student at Walden University, and I'm taking the advanced assessment class. And today I will be completing a full physical assessment, a complete physical assessment. So, my government issued ID. The second thing we're going to do is scan the room, scanning the room. The third thing I would like to do is show you my participant, Mr. Vincent Cousins. And the fourth thing I would like to do is to position the camera. Okay, thank you again, Mr. Cousins, for letting me do this assessment. The first thing that I would like to say is prior to doing this assessment, we did weigh Mr. Cousins and we did assess a weight and we did do a set of vitals. Mr. Cousins is 220 pounds, he's 5'10". His heart rate was 76, his blood pressure was 126 over 72, respirations was 19, and the temperature was 36.8. And he was citing 100% on Romier for that assessment. Now, the first thing we're going to do is look at Mr. Cousins' skin on visual inspection, on the uppers and the lowers, and on his back. I noticed no abnormalities. His skin coloring is symmetric. I see no open lesions. I do assess a couple of moles around the side of his neck and no moles on any other parts of his body. So then we'll do a hands-on assessment of his skin. Warm, dry, no mass is felt on his upper extremities, no mass is felt on his back, warm and dry. Percussion to the back, percussion sounds are nice and even. No problems noted to his back, no problems noted to his upper extremities. His pulses are present. His capillary beds are nice, pink, and healthy. Capillary refills are less than 3. No abnormalities noted to his hands. Mr. Cousins tells me that he is a Mr. Cousins tells me that he is a diabetic and that he goes to the podiatrist every 3 months. So let's look at his feet. Mr. Cousins, can I see your feet, please? Okay, looking at Mr. Cousins' feet. Mr. Cousins' feet is well manicured nails. Capillary refill is less than 3. Pulses are present. Warm and dry. No peripheral edema. No open wounds between his legs. Skin excellent. Let's see a second. Same thing. Nice healthy skin. No peripheral edema. Pulse is present. Capillary refill less than 3. Well manicured nails. Good. Your podiatrist is doing a wonderful job, Mr. Cousins. Your feet looks excellent. No wounds, no your feet. Everything looks good. No major calluses. Nothing abnormal to your feet. Mr. Cousins, next thing I'm going to do is assess your skull. Palpation. Any pain?
No.
Okay, I do notice an old surgical scar. Mr. Cousins does tell me that prior to their success that he did have a meningioma and he did have brain surgery and radiation. That surgical scar is healed perfectly. Mr. Cousins also told me that he sees his neurosurgeon every year. Wonderful. That's a beautiful scar, Mr. Cousins. Mr. Cousins, so nice, benign skull exam. You deny any pain. Your hair is perfect, nice, beautiful white coloring. We're going to do next check your lymph nodes, preacular, postsaccular, tonsils, submandibular, submental, anterior cervical, posterior cervical, subclavicle, anterior clavicle, and occipital. No abnormalities noted with your lymph node, Mr. Cousins. And we're going to do your trachea. Well, we'll do your thyroids first. So thyroid, turn a little. Can you swallow for me? No abnormalities noted with your thyroid, no enlargement. Let's look at your trachea. Trachea is nice and midline. Mr. Cousins, the next thing we want to do is I'm going to have you look at this Shelling chart. I want you to cover eye. Tell me, read a line.
FPH.
Do the opposite.
FPH.
Okay, that tests your visual field, and that was correct, FPH. The next thing I want to do is test your peripheral field. Mr. Cousins, cover eye. Okay, I'm going to cover eye. Tell me if you see my fingers.
Yeah.
Tell me you see my fingers.
Yeah.
Tell me you see my fingers.
Yeah.
Okay, cover the opposite eye, Mr. Cousins. I'll cover. Tell me you see my fingers.
Yeah.
See my fingers.
Yeah.
See my fingers.
Yeah.
Okay, Mr. Cousins. Then we're going to do one. I just want you to follow my fingers without moving your head. Follow my fingers.
Yeah.
Follow my fingers.
Yeah.
Follow my fingers.
Yeah.
Okay, Mr. Cousins, follow my fingers.
Yeah.
Follow my fingers.
Yeah.
Follow my fingers.
Yeah.
Follow my fingers.
Yeah.
Okay, perfect, Mr. Cousins. Mr. Cousins, so you do tell me that you wear glasses, but we're going to do this exam without your glasses, okay?
Yeah.
So-
I wear glasses.
So prior to doing that, let me look at me. Your pupils are round. They do react to light. Conjunctiva is nice and pink. No problems there. So then we're going to look at your eyes. Okay, so. Okay. Red reflex is present. I didn't notice any microaneurysm. I didn't notice any hemorrhages or any neovascularization. And optical discs appear to be fine, Mr. Cousins. Excellent, excellent visual exam. How often do you see your eye doctor?
Every year.
Okay, I suggest that you continue to do that. The next thing you want to do, Mr. Cousins, is can you close your ears? Or close your eyes for me, excuse me. Tell me which ear?
Left.
Which ear?
Right.
Okay, so in visual inspection of your ears, no abnormalities. Palpating your ears, don't feel any abnormalities. Okay, Mr. Cousins, and what we're going to do with me getting the equipment, okay, tell me if you hear it in both ears.
Yeah.
Okay, so Weber test, conduction, white, both ears.
Yeah.
Then we're going to do another one. You tell me when you stop feeling it, and then tell me when you stop hearing it.
Yeah.
Okay, tell me when you stop hearing it.
Yeah.
Okay, so we're going to do another one. Stop feeling it.
Yeah.
Did you stop hearing it?
Yeah.
Okay, so that's the Reiner test, and that's white. It says ear bone conductivity is less than ear, so that's fine. So both tests is no problems. And we're going to look into your ear. Patent ear canal, no drainage notice, and tympanic membrane is pearly gray and transparent. Excellent. So let's look again. Patent earway, transparent tympanic membrane, pearly gray, no drainage noted. Okay, Mr. Cousins, then can you just open your mouth? Okay, smile. I'm looking at your throat. Okay, open your mouth. Looking at your hard palate, looking at your soft palate. Both are nice and pink. You're moist. Open your mouth. Moist. Uvula is present. Your no problems noted, no sores noted, no lesions noted. Excellent, excellent exam, Mr. Cousins. So, Mr. Cousins, what we're going to do is we're going to listen to your lung sounds. Well, first, I'm going to do a feminist test. Say 99 for me.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
Okay, again, say it again.
99.
Doing the front. Doing the front.
99.
Feeling it. Feminist feeling.
99.
Say it again.
99.
Okay, then for diaphragmatic exertion, can you take a deep breath in?
Yeah.
Okay, deep breath in.
Yeah.
Take a deep breath in. Okay, perfect. Okay, so then we're going to listen to your lung sounds. Let's position of the camera again. Okay, listening to your lung sounds. Okay. Okay, nice and clear, symmetric. Okay. Okay, so we're gonna listen to your lung sounds in the back. Lungs breathe in and out. Breathe in and out. even up, even up. Okay, so Mr. Cousins, lung sounds are clear in all your quadrants and no problems there. And the rise and fall of your lungs or your chest equal, even on both in the front and in the back. Your diaphragmatic excursion was fine, Mr. Cousins. So then I'm going to check to see if I hear any carotid bruise. Okay, and I'm just, can you lay back for me? I want you to stand up. And I want you to come up here. Move up. Move up. Okay, and then I want you to lay back down. Okay, so lay down. Okay, gonna help you. Okay, thank you. Okay, thank you. So we're gonna do using a tape measure and a thing. We're gonna try to do your jugular vein distension. Look away from me. Okay, measure the jugular vein distension. 1.5 for jugular vein distension. So then we are going to check for your carotid fluid to see if we see any carotid issues. Fixing the camera. Okay, Mr. Cousins. Okay, so listening to your heart sounds. So doing the S1, S2. Okay, yes. Sound distinguished S1, S2. So no issues there. Jugular vein distension was 1.6. So then we are going to do the apex of your heart. Okay, no issues there. So able to assess the apex of your heart without no problems. So that was a fine, and your jugular vein distension was fine, Mr. Cousins. So Mr. Cousins, after that, so your heart sounds was fine, your apex of your heart was fine. It was able to assess your S1, S2 without no difficulties. So then we are going to do, Mr. Cousins, probably we'll probably have you listen to your bowel sounds while you're laying down. It's probably perfect. Okay, bowel sounds. So bowel sounds are present in all four quadrants. Renal artery. Okay, assess for your bowel sounds and your renal artery, Mr. Cousins. So then we're going to help you back up. You ready? So help you back up, taking our time. Okay, so we did your heart sounds, S1, S2. We did your jugular vein, assessed for your PMI and pericardium. That was fine. So pretty much a very good cardiac assessment. No issues there. We are now going to assess your pulses. So we also checked for your carotid bruise. I didn't feel any thrill or anything. So carotid pulses. We'll do your radial pulses on both ends. Nice pounding radial pulses. Give me your legs. I already checked your pulses when we did your foot exam, but nice pulses. Tibia and so we perfect pulses. So perfect pulses on your lower extremity. So no issues there. And then Mr. Cousin, we are going to assess your okay, so after we checked your pulses, Mr. Cousins, I probably should have done this too. Assess for your liver. Can you lay down a little for me? Just that, Mr. Cousins. Sorry. Perfectly. That's fine. I'll lift your legs up again. We're just going to do, thank you. So this is checking for your liver. And then don't feel any sign of any liver enlargement, any issues, and then the McBurney sign. Any pain when I do that, that's just check to make sure your appendix is no signs with your McBurney, so no issues with appendicitis. So we'll bring you back up. Thank you and sorry for that. Okay, and then we are going to do your pulses. Okay, bicep, tricep, on both. Let me see, bicep pulses, tricep pulses. So then we're gonna do your brachial. Okay, your brachial. So we are going to do your papilla pulses on both, and then we are going to do the last one. And okay, so your pulses are your deep tendon. So no fine. So all your deep tendon was assessed without no problem, Mr. Cousins. Then we are just going to do another exam with the hammer. Tell me, can you feel this? The sensory. Can you feel? So we're doing the sensory exam. Okay. Okay, so then Mr. Cousins, after that, then I want to do an exam with you, feeling different objects, and you're just telling me about the objects and telling me like a sterniogenesis exam, telling me if you feel. Tell me what this is without looking.
Dime.
Okay, so tell me what this is.
Cotton.
Okay, perfect. So you're able to tell me sensory, and basically with the hammer you were able to tell me sensory and set both sensory exams without no problem. And then your motor, can you squeeze my hands upper? Okay, can you push up? Push up? Push down? Okay, can you give me your same thing? Push up? Push down? Okay, and then what we're going to do, Mr. Cousins, I'm going to lift your legs up again in my lap, and we are going to do the Babinski. So, Babinski test, and then on both. So, looking at your leg, doing the Babinski, okay?
Yeah.
And then we are going to do another one, a microfilament test, Mr. Cousins, checking the radial points in your field. Tell me, okay? So microfilament test, okay? Bring that equipment down, and then we'll do another one on the opposite, okay? Okay, perfect, Mr. Cousins, no problem there. And Mr. Cousins, can you stand up and take a couple of steps for me? Walk. Okay, you're walking kind of. You walk with any walking equipment?
Walking stick.
Okay, come back here and walk back here, Mr. Cousins. So you do some little abnormality to your gait, but you did tell me that you walk with a walking cane, and the doctor suggested you use the walking cane. Okay, so can you sit down? Okay. So your coordination, Mr. Cousins. Can you touch my hand to your touch my finger, then to your nose? My finger to your nose. 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 Okay, he's checking for your coordination. Mr. Cousins, then, we did your strength with you, telling me to equal strength uppers and lowers, no problem with that. Then I'm going to do two other tests for you that requires you to lay down. So slide, come up here a little. Come up, come up, come up, come up. Okay, so turn around and lay down. Okay, so one of the exam is you tell me if you feel any pain. Just let me bend this leg. Then I'm going to lift. Do you feel any pain? Okay. And then the next one, we are going to do That was for your irritation, and let me see, let me grab the equipment for your nerve root irritation, which was negative, and then we'll do a meningeal irritation, the same thing. Tell me if you have any pain.
No.
Okay, same thing. So perfect. So can you come back? So Mr. Cousins, I'm just gonna take a look at your spine. Okay, no problem with your spine, no curvature noted to your spine, on palpation, no issues noted with your spine, Mr. Cousins. And then if I did, you will just checking range of motion, uppers and lowers, range of motions, uppers and lowers, Mr. Cousins, no problem there. Been palpating your joints. So range of motions on both of your lower extremities, range of motions on extremities are fine, range of motion on your hip is fine, Mr. Cousins. So on inspection, I didn't notice any abnormalities in your spine, don't notice any curvature. You do walk with a abnormal gait, but you tell me that you walk with a cane in your
I
arm,
have paralysis on my left side.
or you had a little bit of
Well,
deficit.
get my surgery,
Oh, when you had your
I
brain
live.
surgery, you had a little paralysis on your left side. Okay, Mr. Cousins, so that's why you're doing the cane. That's fine, Mr. Cousins. So I think the exam is complete, Mr. Cousins. You did an excellent job. So during this exam, let's just walk through what I've done for you, Mr. Cousins. In this exam, I did a skin exam. I didn't notice any abnormality with your skin, uppers, lowers, front or back, no lesions, no abnormalities, and your skin was nice and healthy. You're following a podiatrist. Your lower feet, your feet was in excellent condition. You were nice, well manicured, no open sores on your feet. Your pulses was present on your feet. Both pulses, tibia and the pedal pulse was present and pounding on both extremities. No problems there. No peripheral edema noted. No issues there. Your strength on your lower extremities was fine. No problems there.
And I thank you.
I then went to your scalp. There was no abnormalities in your scalp except for that old surgical wound, and that is healed perfectly. No problems there. I saw no abnormalities with your lymph node. Excellent job. In fact, no issues there. We then, no thyroid issues, Mr. Cousins. Your trachea was nice and midline, no problems there. When we did your visual test, we did it without glasses, even though you do wear glasses. You were able to read both from your left and right eye on the Schelling's chart with no issues there. We then checked your visual, well, the Schelling's chart checked was your visual acuity, that was excellent. We then checked your extraocular movement, that also was perfect, Mr. Cousins. And then we did your peripheral field, and you really had no problem in your peripheral field. And the actual test showed no neovascularization, no hemorrhage, optical disc was fine. We then went to your ears, Mr. Cousins, and on visual inspection, no issues with either ears, no discharges noted. Your tympanic membrane on visualization was transparent and kind of gray colored. You hear perfectly. You tell me that you do go for eye exam and ear exam on a normal basis, no problem. Mr. Cousins, one thing, I do need to look into your nose. I did overlook that, but we can correct that right away. So let me see your nasal. Okay, no deviation noted, no discharge noted, nice healthy exam. Then let me just do your sinuses, no problems with your sinuses. So Mr. Cousins, your ear, eyes, and nose exam was fine, your neck exam was fine. We then proceeded to your chest, even rise on both lungs. Posterior and anterior lung fields were clear, no issues there. You did not having any recent issues with any colds. We then proceeded to your cardiac, and basically were able to hear your S1, S2 with no problems there. We then checked for your PMI. looking for the apex of the heart. That was able to assess, and the pericardium was able to assess without any issues, Mr. Cousins. Mr. Cousins, I did take the time to assess your abdomen. Bowel sounds was present in all four quadrants. You did tell me you had a bowel movement this morning. We checked your renal arteries. There was no problem with your renal arteries. We then checked your liver. No abnormalities, no enlargement noted in your liver. We did then check your McBurney sign for any issues with your appendix. You had no issues with your appendix. So a very good exam there. Mr. Cousins, after that, we did to your deep tendons and try to assess your deep tendons, Mr. Cousins. Your biceps, your triceps, tricep, brachial, and
knee.
Yes, knee, Mr. Cousins, and your Achilles deep reflex was fine, no issues there. We then did a couple of tests with sensory, with objects placed in your eye. You were able to accurately define what object it was, and then we did sensory using the hammer. Also, you were able to do fine. Your muscle tone was excellent on both sides, Mr. Cousins, no problems with that. And then we did coordination, Mr. Cousins, which you're doing finger to nose, no problems there. Your strength was even, uppers, lowers, and bilaterally, no problems there, Mr. Cousins. Your gait, you walk with a cane. You do have a little bit of left-sided paralysis from your brain surgery. That was fine. We then checked for your nerve root irritation and your meningeal irritations, and both of those were absent, so both very good. We inspect your spine. I didn't notice any major abnormalities with your spine, Mr. Cousins. That was a perfect exam. And then we checked your range of motions, and I checked your joint. Didn't assess any difficulties assessing your joint, Mr. Cousins. I want to thank you very much, and I realize it took a lot out of you to do this with me, but thank you so, so much, Mr. Cousins.
Thank you too.
I want to thank you for giving me the opportunity to conduct this exam. In addition to actually doing the exam, I attempted to just talk through the exam with Mr. Cousins. Mr. Cousins found a couple parts of the test to be a little difficult based on his age, but we were able to successfully complete the exam, and my recommendations to Mr. Cousins would be to follow up with his primary care physician, and noted issues that I would want him to look up into is probably to follow up with possibly doing some cardiovascular exercise to help with his gait. This is Jacqueline Anne-Marie Cousins, a student at Walden University, completing her complete physical assessment. Thank you very much for the opportunity.